Hi, everyone. I want to talk to you again about the difference between being sad versus being depressed, the difference between being stressed about something and actually living with anxiety. I think this is probably very, very misunderstood. And so I wanted to shed some light on that and hopefully help people clarify that. So there's a huge difference between feeling sad and actually being depressed. Sadness, everyone goes through sadness, right? We all have times in life, moments in life that we feel sad. That's just part of being human. Life happens to us and we feel sad. Something is disappointing, something is hurtful, something, even a movie, whatever, might make us feel sad, right? But sadness doesn't stay permanently, right? Or for extended periods of time. Now, there are different things that might make us depressed. Even depression is more longer, more long term. It's a little more chronic. Now, depression can be caused by several things. Okay, we can have an external event usually that causes depression. It can be a chemical imbalance in your brain that's not creating the levels of serotonin, dopamine, and all the good, happy chemicals that your body and brain is supposed to make, that for whatever reason your body doesn't make, right? It's no different than if you were diagnosed with diabetes and your body doesn't make the level of insulin, right? So I think, the big confusion and the big stigma that we have with this is because we call depression and anxiety mental illness, right? So the minute you talk about mental health and mental illness, you immediately assume it's mental, it's in your mind, it's in your head, that you're making it up and that you have some kind of control over this, right? Not necessarily, actually, that's completely false. It's actually a chemical imbalance in our body and in our brain, okay? So what's the difference between, let's look at depression, right? So there's depression that can be caused by an external event. So for example, say, a family member passes away or something traumatic happens, you're in a car accident, you see something sad happen, something traumatic happens and it jolts you. It sort of, shocks you, you're shocked that, and you're sad, that the family member passed away, or say 9/11 happened, or of course, the suicide, that have been happening in our country. I mean, there's so many sad things that we hear about, right? And every person reacts and responds differently to any single event, right? So in a family, God forbid, somebody passes away and my brother is completely fine with it, but I fall apart, right? Or say, where what something happens on in social media, or I mean not media, but in the society, and somebody else is like, oh, that's really sad, and they're fine with it, they pray about it, while somebody else completely falls apart and it impacts them. So there's two responses usually, right? The first one is that it shocks you temporarily, it makes you sad, you go through what is considered the stages of grief, and then you get over it. You kind of work through it. You don't get over it, but you work through it, right? So for example, you go through the different stages of grief are, denial, right? You can't believe this has actually happened. You can't believe that's actually, you're sort of like, no, you don't want to accept it. Denial, anger, there's plea bargaining, there's depression, and then there's acceptance. So what are those things? So denial is, of course, not believing something's happened. Anger, you're just angry and frustrated and can't believe how unfair this is. You're upset and you're just really angry, right? Then there's depression or plea bargaining, and they don't always happen in that order. They go back and forth. Plea bargaining is basically, when you start making deals with God and saying, God, if you just, give me one more day, with my loved ones, if you just miraculously, change something or bring someone back, I will do X, Y, Z. I will do whatever. That's plea bargaining, right? Depression is actually just going through depression, going, oh my God, the loss, yes, they're gone, but I'm so sad and I'm so broken up about it. And then acceptance is finally going through the process of the different stages. And again, there's no time period of how long each lasts. Some of us might skip through one, but usually we go through the different stages and we come through a place where we finally are in acceptance and we accept, okay, this person has passed away and we just have to move on with life. And you go through the grieving process, 6 to 8 weeks, 12 weeks, max, and then life gets back, to normal, so to speak. Now, that's different from, that's still depression. And yes, you could always, go see a therapist. You can always, go to a psychiatrist or a doctor, get some kind of mild antidepressants if you feel like you need that support to get through that period. Nothing wrong with that, right? But sometimes something like this or an external event or whatever, the sadness, the grief, it hits you in such a deep way that it literally changes your neurochemistry. Okay? So what that means is that you never quite get back to your normal chemical balanced self. Your body just doesn't make the level of the happy chemicals, whether it's serotonin, dopamine, whatever, that it needs to create a happy sense. Now, should you take medication? Should you not? I think that's a very personal decision. But, I'm not someone that is a big medication fan, but I'm also not someone that is against it because I understand that mind, body, spirit, we are a human being. We are a soul in a human body. So there's limitations that come with the body, right? And we are, we have a physical, emotional health as well. So I truly believe that you should definitely, your diet matters, your what you eat matters, your mind, body, spirit. So your physical exercise, that matters. But I also believe, that if there's a chemical imbalance, and seeing a therapist matters, but if there's a chemical imbalance and it's severe, it doesn't matter, to a complete how much of the other stuff you do. If you need the meds, you need the meds, right? And so I have people saying, well, why do I need to take the meds? Or do I have to take them permanently, right? And the question I ask people is, well, if you were diagnosed with, say, diabetes, right? And you had to take insulin, you were told, sorry, Anita, you're diagnosed with diabetes, you have to take insulin. Would you even consider asking the question, or maybe you would, but would you say, do I have to take it for the rest of my life? Do I only take it for a month? Can I stop taking it? I respect that people don't want to put artificial, medications in your body. I respect that, right? I get it completely. I'm all about natural stuff. I'm all about using whatever you can, to heal yourself. And I believe you can. But I also believe that, medication is important to balance you out. While you do, then the other work, whether it's mind, body, spirit, the meditation, the energy work, doing, yoga, doing healthful stuff, changing all that, using essential oils. But I don't think you can just completely not take the meds and pretend like you're going to be okay, because it's not. It affects the quality of life. I have been on and off antidepressants for many years, over the years, as I've needed them. Right after I delivered my first child, I went through postpartum depression, took the medication, sure. And then I got off, and then I realized my body was just, for whatever reason, due to many different reasons, was not creating the levels that I needed. So I was depressed, and I didn't even realize I was depressed. Sure, over the years, recently, since I do what I do, God, shukr alhamdulillah, I'm able to, reverse a lot of the stuff, and I don't take anything anymore. But that doesn't mean that I'm against medication. I'm the first one. God forbid, if what I'm doing is not working and I'm in an extended period, I'll be the first one to go get back on some antidepressants or anti-anxiety medication if I need it. So I don't think there's any shame in it. Obviously, there's no shame because I'm talking about it, right? Would you think any less of me just because I'm taking medication? Would you think any less of me if I told you I had a heart condition, I'm taking aspirin? Am I weaker because I'm taking medication? No. What good am I to anyone, especially my loved ones, if I'm not completely healthy and balanced, right? How can I help others if I'm not even able to help myself? And depression is very real. Anxiety is very real. So let's talk about anxiety now. So you have the normal stress. Stress is worry, right? How does stress manifest? We worry about things. Some people worry more than others. I think anxiety is when it's chronic. Chronic is long term, right? How does it manifest itself? you kind of we people, that stress are sort of obsessive in their thinking. They're constantly worrying about, what could have happened, what should have happened, or what happened. Oh, I should have done it this way, I should have done it this way, or if only I had done this differently. And then they kind of replay their past, thinking maybe they could have changed something. But the reality is you can't. But they can't stop worrying about it, right? I've had people who call me and just to sort of ask for opinions or consultation or whatever. They'll say things like, oh, that's just my nature. My nature is I always stress. I've always been a worrier. And I kind of listen, and then I listen, and then I finally say, it's I get that it's your nature, but sounds like you're living with anxiety. It's a little more, it's not your nature. It's actually your diagnosis. You should have been, you have anxiety. Your nature as a worrier is what we used to do when our grandmothers and grandmothers, right? Before we really were aware of mental illness, we all have that aunt or that cousin or that grandmother, who was just a worrywart, right? Or what would we call it? We had all these wonderful Indian sort of, degrading names, like, I don't even know what they are, but basically, it's rotal khichdi, like she's always crying, she's always whining, she's just a, crybaby, kind of a thing. But the reality is, they probably were living with depression. They probably suffered from anxiety. We just didn't know any better, and they certainly didn't know any better, right? And imagine if in this day and age there's so much stigma about taking medication. I mean, God, it was even unheard of. Forget medication, it was unheard of to even acknowledge that there was such a thing as mental illness. So I think there's a difference. If you're able to function and handle your depression and your anxiety, through diet, exercise, spirituality, meditation, all that good stuff, good for you. Great. You can stop watching, right? But if you're doubting yourself, and if you've wondered, if you possibly have something chronic, then I think you should, excuse me, then you really owe it to yourself to go get a professional evaluation, right? Go see your primary doctor. That's a great place to start. But also, if you're able to, preferably go see a psychiatrist, not a psychologist. So the difference between a psychiatrist and a psychologist is this. A psychiatrist is a medical doctor that specializes in mental illnesses, right? So depression, anxiety, bipolar, schizophrenia, the whole gamut, right, of what have you. They are trained not only in the body, but especially to treat mental illness with medication. A psychologist is a doctor, but they're trained in talk therapy. They're not. They're not a. They're not a doctor in the medical sense. They might have the doctor degree, but they're more. They cannot write a prescription. They cannot. They have not studied that. So sure, you can go see a psychiatrist if for a psychiatric evaluation to determine if you actually have a chemical imbalance that needs you to take antidepressant or anti-anxiety medication. Now, medication is not always the first option. I think therapy is a great way to start. But if you're really that depressed or that anxious, you're not really going to benefit or be able to even engage fully in therapy unless you take the medication that kind of levels you up and levels you out, and then you can kind of open up and do what you need to do in therapy. So a psychologist, a social worker, a mental health professional, a license, and these are the different accredited licenses, in U.S. So you've got the marriage and family therapist, you've got the mental health counselors, you've got the licensed clinical social workers, and of course the psychologists. We're all licensed and trained to be able to do counseling, therapy, what have you, with individuals and whatnot. So sure, therapy is a great place to start, but if therapy alone is not enough, please take the medication, right? Because at the end of the day, I think it's we're mind, body, spirit. So I hope this has been helpful. Please feel free to reach out and inbox me if you have any questions. And, be open. That's all I ask, guys. Be open, because let's talk about this. Let's I don't think anybody I really think that we are way past the time, guys, where we are embarrassing or shaming each other because of mental illness, right? I don't think that anyone is less of a person because they have depression. I don't think it takes away from their intelligence. I don't think it takes away from their heart and how amazing they are. I don't think it takes away from any of their creative qualities. If anything, I think it adds to it, right? Oh, and but while I'm talking about it, let's talk about bipolar. I totally forgot to talk about that. Bipolar disorder is basically where you have anxiety and depression together. How does that show up? So basically, you have your manic states, which is your anxiety states, which shows up as, high energy, fast talking, a lot of energy, so a lot of worrying, but also like, you're cleaning up the house. You have so much energy. You're just rushing, rushing, rushing. You're just in a flurry, like it's like a tornado. You just have energy, and so in that high manic energy state, like I said, you clean up the house. You do risky behavior. You go charge up your credit cards. You go partying. You go gamble. You have, you do risky behavior, like you sleep with different people because you're not thinking things through. You're just doing very risky behavior because your mind is functioning, firing away so fast. You're not really stopping to process the consequences. Versus then you hit the depression state, the ups and the downs of bipolar, right? Your ups and downs. And the down is deep, deep depression. You don't have the energy. You're physically just exhausted. You don't want to get out of bed. People who are depressed won't shower for days. They will avoid, brushing their teeth. They won't change their clothes. There's either a loss of appetite or there's an increase in appetite. There's a loss of sleep. They can't sleep or they sleep too much. It's unfortunate that it's not as simple as one way. Depression doesn't just look in one way, right? Because I've worked on the psychiatric unit for as many years as I did, I was able to see the different faces of what depression looks like. So, I was able to see one extreme to another. I was able to see what a state of, anxiety looks like, and all the different faces of anxiety, right? I was able to see people come in, that were Baker acted, that were, suicidal and depressed and, couldn't get out of bed. And then, after a few days or after a few weeks of being on the unit, they were actually participating in groups and they were once they were stable on their meds, they were actually able to function and engage. I've seen what schizophrenia looks like. I've seen, what hearing voices looks like. I've seen what, psychosis looks like, bipolar looks like. So when you've seen enough of this, it's the thing I'll tell you is it doesn't just look one way, right? So that's why trust a psychiatrist. One last thing I'll tell you is, people get very frustrated when they go see a psychiatrist because the psychiatrist, it feels like they just are in and out of the office in 15 minutes, right? The psychiatrist spends a few minutes and they don't really spend the time to talk to them. There's a difference between a psychiatrist and a psychologist. A psychiatrist is not going to sit here and do therapy with you. You get the hour of therapy with the psychologist or the therapist. A psychiatrist, if in my little experience, I can walk into a restaurant or a diner, and I feel pretty confident. I'm not bragging. It's almost sort of a burden, that I can stand and look at people, and simply just by observing them, for a few minutes, and especially if you give me 10 minutes with someone, I'm pretty close to diagnosing them. I can tell who's depressed, who's mildly depressed, and who's severely depressed. I can, I've seen the different faces of it. So if my, little self with the little experience I have can pretty accurately diagnose people, imagine what a psychiatrist can do, given that they do this day in, day out, years of training, years of schooling, and years of experience. So don't get upset with a psychiatrist if they only spend 10, 15 minutes with you, because they don't need to really get into a lot of, long details with you, because you tell them a few things and it's an indicator of what they've already seen, right? A lot of times you will also fill up a detailed history. So before you see the psychiatrist, their assistants have normally, sort of reviewed that with them, reviewed that with you. And so that's why, don't hate on psychiatrists just because they're not spending an hour with you collecting your history. There's very few psychiatrists these days that actually do that. And I'm impressed that they do that, because unfortunately, with managed care and insurance, and they have to keep it going. So trust, but at the same time, you shouldn't feel like your psychiatrist on repeated visits is not spending time asking you the questions to make the adjustment for the medication, right? So if someone is on medication, it is crucial that you go back every 4 weeks at least, if not 6 weeks or whatever. Sometimes they schedule it, they give you a 3-month refill once you're stable on a specific dose. Because what happens is our body chemistry changes, right? Especially as you get older, you get younger, you're a woman, man, whatever. So the meds that used to work fine, 1 month, 2 months, 3 months, sometimes it needs adjustments. Sometimes it doesn't work as well. Sometimes you kind of get immune to it, so you need more of it, less of it, something different. That needs to be done by a psychiatrist. That is why you follow up and you continue to go to a psychiatrist. So, make sure you sort of, and at the end of the day, always trust your instinct, trust your gut. The last thing I think I want to talk about medication is, one of the biggest mistakes that I've seen people do time and time again when they take medication is that they take medication for anxiety, for depression, for schizophrenia, whatever the medication is, right? And after they take it for ADHD works a little different, because ADHD medication literally works only for 4 to 6 hours, and then the medication comes out, so you take it every day. But the antidepressants and the anxiety medication work differently, because they need to build into your system, into your bloodstream, into your body chemistry, for it to completely work as well as it's supposed to. So some medications take 2 weeks, some take 4 weeks, whatever. Each medication is different. So what happens is when you take a medication for whatever long, 4 weeks, 6 weeks, a month, 6 months, whatever, and you start to feel good, right? You start to feel healthy. And so you start thinking, oh, I don't need the medication anymore. I'm feeling fine. I'm fine. What people are not realizing, and they very conveniently and very genuinely, forget that it's the medication, the continuous medication that you're taking, that is actually helping you stabilize your neurochemistry. So it is super, super important to continue to take the medication as prescribed. Now, if you want to get off your medication, please don't just stop. It is extremely dangerous to just stop taking an antidepressant or an anti-anxiety medication, because you literally could crash emotionally and become suicidal, or become even more depressed, or have a manic episode. You might trigger something even more serious than what you already have. If you actually do want to stop taking a medication, talk to your psychiatrist, work with them, let them wean you off the medication. And then fine, get off the medication if that's what the doctor and you agree that it's the right thing for you to do. But honestly, if you have to take a pill or 2 pills or 3 pills once a day for the rest of your life, and if that is impacting your quality of life in a positive way, who cares, right? Who cares? Take the medication. And again, it's nobody's business what medication you take. Unfortunately, until we stop judging each other, for being on meds for mental illness issues, keep it private. That's your business. You don't owe anybody an explanation. You don't owe anybody that information. That's where your privacy, your HIPAA laws, come in, where you really don't owe anybody anything. Take the meds, feel better, have a better quality of life, go see a therapist, do your mind, body, spirit, meditate, find safe coping skills, do whatever brings you joy and happiness. And as always, I strongly recommend